video, we're going to look at the proper technique for drawing up medications out of a vial. So this might be for an IV push, a sub-Q, or an IM injection. Of course, your very first step is going to be to calculate the required volume of medication needed. In this case, once you calculate it, let's say that you need 2 milliliters of the medication. So now you can pick your syringe. In this case, a 3 milliliter syringe is perfect. And then you're going to want to attach a blunt tip needle to that syringe. Now you can remove the lid from the vial and clean the top of the vial with an alcohol pad. This cleaning step is especially important if you're using multi-use vials. Now, since these vials are vacuum sealed, you have to replace the volume you want to remove with air first so it doesn't explode. So draw up air in your syringe equal to the volume of medication required, so 2 milliliters of air. Then you're going to insert the needle through the rubber stopper and inject the air into the vial. Then invert the vial completely with the syringe in it and slowly draw up the med to the prescribed volume. Careful not to draw it up too quickly or you'll get air bubbles. Now you can take the needle out of the vial and flick or tap the syringe to get any air bubbles out of it. Sometimes I'll use a pen even to save my fingers. It's less painful on my fingers. In some cases, you may have drawn up too much. If this is not a multi-use vial, you can inject back into the medication vial or into an appropriate receptacle depending on your facility's policy, usually not down the sink. So now to proceed with administration, you have to remove the blunt tip needle. You can do that by carefully twisting it off from the base or by safely recapping it with the scoop technique, and then you can remove it and throw it in the sharps container. Now that you have your med drawn up, you can immediately move to administering it based on whatever the route is. But if you aren't going to administer it right away, you must label the syringe with the drug, dose, and date, time, and initials. So check out the specific route administration videos like sub-Q, IM, and IV push for details on how to give those. Now go out and be your best selves today. And as always, happy nursing.